This short presentation tells the story of the organizational and goal alignment for the orthopedic value stream across Nemours. The value stream grew out of the 2013 strategy sessions on integration and market growth. Orthopedics is core to Nemours' history. A.I. DuPont's widow Jessie hired Alfred Shands from Duke as medical director in 1940. He remained as director until G. Dean McEwen succeeded him in 1969. The institute provided free care until the 1970s. Only in 1976 did the Nemours Board of Directors expand the institute's mission to encompass beyond orthopedics to other pediatric diseases. During the Integration A3 sessions in late 2013, Dr. Frick was one of the advocates for an orthopedics focus. He led the development of the broad plan shown here. It encompasses clinical excellence and patient experience. It advocates reduction in variation of care and the harmonization of costs. It also suggests some possible areas of early focus: skin integrity, pin site infection reduction, and patient satisfaction at clinics and hospitals for elbow injuries. It also suggests later focus on clubfoot, scoliosis, and limb deformities. The broad conceptual umbrella suggested are injury prevention, access, although not necessarily for some acute injuries that receive priority care today, quality of outcomes and experience, and total cost. Coupled with the overarching True North goals of quality, safety, delivery, cost, and people, these form the basis for our value stream's goal alignment. An integrated value stream transcends locations, departments, and roles. Because many of the gaps between our current performance and True North are the structural result of locational, departmental, and role silos, the value stream holds the promise of improving patient care and raising the number of patients served, cost, and reputation simultaneously. It does this by improving collaboration, and collaboration in turn is improved by virtue of the value stream. The tools deployed by the value stream drive us to reduce waste and errors. Features of the continuous improvement methods used in the value stream include a reliance on frontline participation and the explicit engagement of leaders in reducing the barriers that frontline workers face while serving patients and families. In a value stream, we deploy enterprise goals all the way down to specific week-to-week plans. The initial setting of True North goals is carried out at the enterprise level, moving down through the organization to specific locations with individual owners. In this way, we can be sure that the lowest level plans contribute to True North. But if the deployment ends here, we cannot be sure that the plans are sufficiently impactful, or that they are realistic and resourced. This is a shortcoming of the old method of management by objectives. One of the many strong contributions of W. Edwards Deming as taught to Toyota was to encourage a richer deployment that assures alignment. Under this version of planning, each transfer of goals is not an order to be executed, but a conversation about direction, feasibility, priorities, and implications. If we follow this method, we can be much better assured that our final plans are aligned, feasible, and comprehensive. While the conversations described previously are necessary, they're not sufficient to ensure that our plans will be effective in moving towards True North, or that they can be tracked easily to completion. To do that, we employ a qualitative linking tool called goal deployment. It involves listing the True North goals and the plans and then projects to accomplish them. The projects at each level become the plans at the next level. At the lowest level, the projects are assigned to responsible people with progress timelines and links to metric that indicate progress. As the green checks here indicate, we complete conversations and also the linking matrices. At that point, we have confirmed sufficiency, effectiveness, and we have designed a tracking mechanism. This example illustrates a quantitative goal deployment. In practice, there are many possible performance gaps, of which we select 5 to 10 to represent our current state. Once we've agreed on the performance gaps, we agree to one or a small number of future state targets for each element of the current state. Once this is done, the core team works with stakeholders to develop a list of possible root causes. They narrow those down using data where possible to those that are impactful and possible. Finally, process owners are engaged before, during, or after the alignment session in setting plans, dates, and metrics. Like all plans, alignment involves plan, do, check, and act. The check of our planning progress comes as we monitor measured performance against plans in the coming weeks and months. We have another series of conversations leading us to our ability to move towards true north. There are multiple views possible on a value stream. One of them is the A3 or ledger-sized story in 6 or 7 steps. We can see here how the goal deployment elements are simply rearrangements of the A3 story. The A3 itself can express the implementation of a strategy at only high level, or it can link to child A3s lower in the organization. Another representation of the initiation of a value stream is the stages and gates model. It uses the same information but presents it in a way that highlights major progress checkpoints. Here, the same elements of goal deployment are laid out within task groups or stages and with deliverable outputs for each stage. Key deliverables are called gates insofar as they provide go-no-go monitoring points for the project. For example, we cannot pass through the gate to determine remedies until we understand and have quantified the gaps between current and desired future states. A final representation is the Gantt chart. Here we can see the aggregation of the low, medium, and high-level activities into a graphical representation across time. Typically, when we create such a plan, there is one set of activities that form the critical path, the pathway of linked work items that solidly define the duration of our project. There are, of course, many other work items that are linked to each other, that are concurrent or are required before other items can start. We monitor each of those to ensure that our overall plan stays on track. When we have a plan that is deployed, measured, and monitored, we have a much better chance of helping our patients and families appreciate our true north success.